Ever heard of mumps? It's more than just a funny-sounding word. It's a viral disease that can have serious implications for your health. This contagious disease has some characteristic symptoms that are hard to miss. Picture this: a fever that makes you feel like you're burning up, a headache that's more than just a minor nuisance, muscle aches that make it hard to get out of bed in the morning, and swelling of the salivary glands. This swelling is what leads to the most visible sign of mumps: puffy cheeks and a swollen jaw. It's almost like someone inflated a balloon inside your mouth. And while these symptoms might sound strange or even somewhat amusing, they're anything but. These are signs of a serious viral infection that's spreading through your body. Keep in mind, mumps is not something to shrug off. It's a serious health concern that you need to be aware of. Now that we know what mumps is, the question arises: what causes it? Mumps is a viral infection specifically caused by the mumps virus. This virus belongs to a family of viruses known as Paramyxoviridae, which are responsible for a host of human and animal diseases. But let's focus on mumps for now. Just like most viruses, the mumps virus is incredibly tiny, invisible to the naked eye. It's an invader, seeking to use our body's cells as hosts to multiply and thrive. And it's particularly fond of the salivary glands, hence the characteristic swelling we see in mumps patients. Now, how does this virus get around? Well, it hitchhikes on droplets of saliva. When an infected person talks, coughs, or sneezes, these droplets are expelled into the air and can easily be inhaled by those nearby. It's like a microscopic, unwanted passenger catching a ride to its next destination: our bodies. Another way the mumps virus can spread is through direct contact with infected saliva. This could be through sharing utensils, cups, or even lip balm. It's not just close proximity that's a risk, but also sharing personal items. This is why mumps often spreads like wildfire in settings where people are in close contact, like schools, dormitories, or sports teams. This makes mumps highly contagious, especially for those who haven't been vaccinated. Yes, vaccinated individuals may still contract mumps, but the symptoms are typically milder, and the risk of complications is lower. So, you see, the cause of mumps is not just the virus itself, but also our behaviors and environment that enable the virus to spread. It's a reminder that our actions, like maintaining good hygiene practices and getting vaccinated, can play a big role in preventing the spread of diseases like mumps. Remember, mumps is highly contagious, so it's crucial to maintain good hygiene practices. What does having mumps feel like? What are the signs that you should look out for? You might be wondering. Well, let's dive into the common symptoms of mumps and explore each in detail. Mumps can make you feel pretty lousy, and the symptoms often start with general malaise. You might feel tired, weak, and experience loss of appetite. This is your body's way of telling you that it's gearing up to fight an invader. Then the fever hits. It's not just a mild rise in temperature. We're talking about a full-blown fever that can leave you feeling hot, sweaty, and shivery all at once. This fever is usually accompanied by a headache, which can range from a dull ache to a pounding throb. Next, you might start to feel muscle aches. These are not your regular post-gym soreness. They're more like the deep, throbbing pain that you get with the flu. The aches are usually diffuse, meaning they can be felt all over the body, but they might be more pronounced in the back and neck region. Now here's the symptom that really sets mumps apart: the swelling of the salivary glands. This swelling typically starts in one gland and then spreads to the others. The glands become tender and hurt when you chew or swallow. This is the reason why people with mumps often have difficulty eating or drinking. As the salivary glands continue to swell, they can cause the cheeks to puff out, giving a characteristic chipmunk appearance. Along with the puffy cheeks, the jaw may also appear swollen. This combination of swollen glands, puffy cheeks, and a swollen jaw is often the telltale sign of mumps. So, what should you do if you notice these symptoms? Remember, mumps is not just a simple cold or flu that you can shrug off. It's a contagious viral disease that can lead to serious complications if not treated correctly. Therefore, if you or someone around you is showing these symptoms, it's critical to seek medical attention. Now that we've understood the causes and symptoms of mumps, how do we treat and prevent it? Let's start with the reality. There's no specific treatment for mumps. It's a virus, and like most viral infections, it usually resolves within a week or two on its own. The body's immune system is typically capable of fighting off the mumps virus over time. However, that doesn't mean you have to suffer in silence. While you can't cure mumps, you can certainly manage its symptoms. Rest is crucial during this period. Your body needs energy to combat the virus, and resting allows it to focus its resources on this battle. Hydration is another key aspect. Fever and sweating can lead to fluid loss, and dehydration can exacerbate feelings of discomfort or illness. So, keeping up with fluid intake is important. Water is your best friend, but broths and soups can also be beneficial, providing both hydration and nutrition. Over-the-counter pain relief, like ibuprofen or acetaminophen, can also help with fever and discomfort. But remember, these are just to manage symptoms. They don't shorten the course of the illness or kill the virus. Now let's talk prevention. The most effective way to prevent mumps is through vaccination with the MMR vaccine, which also protects against measles and rubella. Even though vaccinated individuals may still contract mumps, their symptoms are typically milder and the course of illness shorter. The MMR vaccine is usually given in 2 doses, first at 12 to 15 months of age and the second at 4 to 6 years of age. However, if you missed these vaccinations in childhood, it's not too late. Adults can and should get vaccinated, especially if they're in a community where mumps is prevalent. Remember, prevention is always better than cure. Make sure to get vaccinated and encourage those around you to do the same. Let's revisit what we've learned about mumps today. Mumps is a contagious viral disease causing discomfort and potential complications. It's typically characterized by fever, headache, muscle aches, and the hallmark swelling of the salivary glands leading to puffy cheeks and a swollen jaw. It's a sight that's hard to miss. We've learned that the mumps virus spreads through close contact, just like a cold or flu, making it a concern in densely populated areas, or amongst groups with close contact. This can be through the sharing of utensils, cups, or even through respiratory droplets, when someone with the virus coughs or sneezes. Recognizing the symptoms is crucial. Aside from the aforementioned swollen salivary glands, other symptoms may include fatigue, loss of appetite, and in some cases, complications such as inflammation of the brain, ovaries, or breasts can occur. Remember, early detection is key to effective management. Now let's talk about treatment and prevention. There's no specific treatment for mumps. Care is generally focused on relieving symptoms until your body's immune system fights off the infection. This might involve rest, hydration, and over-the-counter pain relievers. But prevention is always better than cure, isn't it? And that's where the MMR vaccine comes in. Mumps, measles, rubella. This vaccine provides protection against all 3. Vaccination is the most effective way to prevent mumps, although outbreaks can still occur. Vaccinated individuals may still contract mumps, but their symptoms are typically milder. In conclusion, mumps is a serious health concern, but it's not unbeatable. With the right knowledge and precautions, we can keep it at bay. Remember to seek medical attention if mumps is suspected, and ensure you and your loved ones are vaccinated with the MMR vaccine for the best protection. Mumps is a serious health concern, but with the right knowledge and precautions, we can keep it at bay. Stay safe, stay informed. That's all for today's deep dive into mumps. We've covered a lot of ground, from understanding the causes and symptoms to discussing the crucial aspects of treatment and prevention. It's been a comprehensive journey, and we hope it has been as enlightening for you as it was for us to present. We encourage you to share this video with friends, family, and anyone else who could benefit from this information. A simple share could go a long way in spreading awareness about mumps, and might even make a significant difference in someone's life. We also invite you to leave any comments or questions you might have about mumps. We're always here to engage in a meaningful discussion and to help clarify any doubts you might have. Your active participation not only enriches our community but also contributes to a wider understanding of this topic. Remember, knowledge is power. The more you know, the better you can protect yourself and others. Stay tuned for more health-related topics. Until next time, take care.